Well, welcome everyone. We're excited to host you here for another Family Medicine Education Consortium webinar, looking back on the best seminars and sessions that we had at our 2022 meeting. And today we're eager to present on updates for osteopathic recognition. That is Osteopathic Recognition 2.0, new and improved. I'm Aaron George. I'm a family physician, a board member for the FMEC, and I also serve as Associate Dean for the proposed Emeritus School of Osteopathic Medicine, a new medical school focusing on primary care in rural Western Maryland. Now, I'm a proud member of the FMEC, and I have been for quite some time, and we are just so honored to have the opportunity to work with medical schools, with residency programs, with institutions and others throughout the Northeast to seek to strengthen education and strengthen the primary care pipeline. We're glad you've joined us today. We hope you'll look to join us soon in October as well for our annual meeting in Providence, Rhode Island, which will be held October 13th through the 15th. We really, truly look forward to seeing you there. Now, for today's session, we're happy to welcome Dr. Abby Rhodes of St. Luke's University Health Network and Laura Edgar of the ACGME to discuss a little bit more about new and improved updates for osteopathic recognition.
Hooray! We have our slides. Okay. Next slide, please. Neither of us have any disclosures for this particular session. Next slide. If you have questions afterwards, please feel free to reach out to Abby. She can help you with the really technical pieces about what you're going to do together. Of course, if you have questions about milestones in general, you can feel free to reach out to me at milestones@acgme.org. Next slide. So here are some of the things that we're going to be talking about, the new milestones, how to use the supplemental guide, how to apply them with the family medicine milestones, and then also resources that are available. Next slide. And a big thank you. These are all the folks that we worked with. They really represented the breadth of osteopathic medicine in terms of their primary and core specialties. And again, they're just fantastic to work with. Next slide. So I'm hoping that all of you already know what milestones are, but really just to kind of reiterate a little bit about what we think about is that these are significant points of development that happen throughout the time that your learners are with you in their program. These are things that are going to take time to develop. These are not sort of one and done things. But again, thinking about these key and primary aspects of the different knowledge, skills, and abilities that they have to demonstrate. Next slide. So again, this one, when we're thinking about our progression, this is different from the original milestones in that when we first thought about this, we were thinking about in terms of that level 3 was really for a resident graduating and level 4 was for a fellow graduating. But really the new milestones are a single progression. And it's going to be really important to remember that it doesn't matter where they are or what their level is. It's all about the narrative. Next slide. And in fact, to be really clear about it, it has nothing to do with their level. Somebody can come in and be at a level 3. If they had a really great experience while they were in school, maybe in their intern year, they were able to really accomplish a lot, and you go to evaluate them, they could already be at a level 3 or a level 4. Then again, if you have somebody who's an MD who is just now taking osteopathic training as part of their residency, they might only be at a level 1. They could even be at a level that is not yet achieved level 1, and that is okay to do. Remember, it's all about the narrative. Next slide. There we go. So again, I've already said the narrative part, but it's also important to remember that oftentimes we use our resident management systems as the way we gather assessment tools and the assessments from the various faculty that they work with. And be really careful, because those systems, they can pop out a number and tell you that a learner is at a particular, 3.7652123, so on, to come back and tell you, your CCC, that that's where they are. And in essence, it doesn't really mean anything until you read what it actually says. Next slide. And finally, remember that the milestones are designed to be formative. They're the repository for all of the other evaluations that happen throughout that 6-month period. Of course, you can evaluate milestones more often. However, we don't think that milestones should be evaluated on every single rotation. You should really be contemplative about where you're going to evaluate each of these particular subcompetencies. And also remember that not everything that needs to be evaluated is included in the milestones. And that could certainly happen to you if you've got somebody in a particular rotation. And let's say that there's a key thing that they have to demonstrate, whether it is part of family medicine or part of osteopathic recognition. Not everything is going to be in there. So you have to make sure that you still have a robust assessment system that is going to look at all of those elements. Next slide. And we really love Milestones 2.0. There have been a lot of improvements that have happened in the conversion. I hope that you feel the same way too. Of course, we are always happy to take feedback. If you have comments, you're always welcome to send them to milestones@acgme.org. Next slide. And at this point, this is kind of showing a little bit more of what I started to talk about when I was trying to ad-lib at the beginning, in that we try to make things not only simplifying the language, but also making sure that everything had a complete trajectory that went from that level of novice all the way up through proficient and expert. Next slide.
And I could take over here, Laura.
Great.
So when we didn't put in all the milestones, because hopefully you are using them as they went live in July, but we did just want to kind of say how to get familiar with these new milestones. And that is, you'll see that for each milestone, there's only 2 longitudinal parts in each milestone. And that was on purpose. We wanted to change it so there wasn't like 3 parts in one level and it didn't kind of progress through. So that was one of that, as well as you'll notice a lot on the second line is that's talking about somatic dysfunction and diagnosing and treating, because not every residency is going to be doing that, especially if you're like a surgery residency. However, it does apply for our family medicine residencies because most of those are doing OMT on patient care. Next slide. So we're just going to give an example of the supplemental guide here. Next slide. So hopefully everyone has been able to take a look at the supplemental guide, but this is overall how it looks. There's examples for each level. We did try to incorporate examples for all specialties and fellowships, which is a very hard task to do, but we try to include peds and OBGYN and surgery. But luckily for family medicine, you can kind of use your own, all those examples because they're pertinent to you. And next slide. And as you dissect down to this, you'll see there's an I and an O for each one, and that gives inpatient and outpatient examples. So those are all great. But the purpose of this is there is a document, a Word document of the supplemental guide that you can download from the Osteopathic Recognition ACGME website and type in what your own examples are pertinent to your own program for each of these and try to come up with your own examples and map this out. Next slide. And as you can see, there's just some examples of how you could do assessment tools such as chart review or direct observation. There's also some resources. But again, and opening to do curricular mapping, which you can do on an individual program basis. Next slide. And I just wanted to bring up this one because this is the practice-based learning. A lot of people bring this one up, and it just gives some more examples of how to do self-evaluation of personal practices and identifying practice gaps, such as during an evaluation meeting with the program director sets a personal goal to perform 2 OMP procedures during their regular scheduled clinic days. So again, just kind of further giving examples, because sometimes the system-based and the practice-based and osteopathic recognition, it's hard to delineate that osteopathic recognition from, regular milestones and how to make it osteopathically unique. Next slide. So again, you want to review the milestones with your CCC faculty and residents. You want to identify the assessment method in your toolbox so you'll provide the best information and determine which rotations will evaluate which milestones. Next slide. And you also want to consider how osteopathic recognition milestones will work with your specialty, and I'll be talking about how to make these work with your family medicine residency. Next slide. So here we're going to talk about how to incorporate these into family medicine. Next slide. So obviously with mind, body, spirit, there's a lot of crossover with osteopathic milestones and family medicine milestones because treating mind, body, and spirit is very common with all family medicine providers, but is osteopathically unique. And as I said, there's a lot of crossover, especially with communication, PBL, and systems-based practice. But we had to keep those in because we have to align with the osteopathic recognition requirements. Because a lot of people had asked, like, why are we keeping those milestones in there? Next slide. So again, the supplemental guide has the inpatient and outpatient examples, and they're more geared towards primary care because it has family medicine, especially taking care of all ages of pediatrics, geriatrics, and OB. It wouldn't be feasible for us to do a single example for every specialty. So that's where you come in and do your own examples for your own program. Next slide. It's also really great to have resident involvement in their self-evaluation of their milestones. So try to simplify that as much as you can and make it easy for them. So there are many different platforms that residencies use, such as New Innovations, MedHub, or MyEval. So the next slide I'm going to show you here is an example of New Innovations. This is what we have for our program. It's all already in the background, very easily, just click of a couple buttons about how you can pull this up. And as you can see here, this particular resident, they documented themselves as a level 2 and then a level 2.5 for patient care 1 and patient care 2. This is really great because, they can identify their own weaknesses rather than kind of straight lining themselves and just saying, well, I'm a second year, so I'm all 2s. But it's easy for them to delineate between the two, between one level and the next level in this kind of easy format. And it gives them participation in their own milestones prior to their CCC meeting. Next slide. So here's an example observation of how to tie this all together. So this was a note documented from a PGY2. It was a 44-year-old who presented for cervical muscle pain and tenderness after an MVA in October. The patient was a restrained driver when the car behind collided her with her rear bumper, causing her to hit the car in front of her. Imaging was done in the ED, including CT head and spine, which was negative. Patient reports some persistent shoulder and neck pain and paresthesias behind the neck radiating to the mid-back, as well as insomnia. They've had no relief from what they have tried, which is Tylenol, and they state that the accident makes the patient feel more nervous and fatigued, and they've been less productive at work. So the plan that they wrote was cervical muscle strain secondary to whiplash from an MVA. They reviewed the imaging studies from the ER, no acute traumatic injuries, no relief, and they have possible confounding factors, including stress and anxiety from the accident. So they recommend ibuprofen as well as to follow up for OMT in 1 week. They also report some plantar fasciitis, and again, gave some recommendations for that, as well as return for OMT, and also talk about adjustment reaction from their anxiety, and gave them a list of therapists near their home. Next slide. So the patient comes back in 1 week and is documented. The resident is only observed and independently performs the procedure. So the resident verbalizes to the attending that they only perform indirect techniques due to whiplash and will defer OMT to the ankle because they had a positive Ottawa ankle rule, and they're going to obtain an X-ray. They also referred to ambulatory referral to physical therapy and added Robaxin. And they document their allopathic diagnosis first, and then their 3 somatic dysfunction of the regions that they treated, and then build a 99213 with a 25 modifier and a CPT code for 3 to 4 regions. Next slide. So how do we tie this all together in this example? So when we're looking at the ACGME family medicine milestones, we are looking at patient care 1, level 2, because they're developing a management plan for common acute conditions. And they're also identifying the interplay between psychosocial factors and acute illness. For system-based practice 3, level 2, it demonstrates the use of information technology required for medical practice. So they're looking at those CT scans and ER notes. And then systems-based practice 2, level 2, they're coordinating care of patients in routine clinical situations, and using the interprofessional team members with the referral to PT, and also ICS 2, level 3, they're compassionately delivering medical information, managing patients' goals and uncertainties. So as you can see, just from the regular family medicine examples, they're a level 2 in some aspects, and then a level 3 in the last aspect. Then we look at the osteopathic recognition milestones. Patient care 1, they're a level 3 because they did it just by observation of the attending. They effectively manage patients with common conditions using OPP to promote health and wellness, also taking in their psychosocial factors in there with their anxiety. And then patient care 2 for their OMT, they're a level 3 to a level 3.5, whether you want to call this whiplash a complex patient or not, because they're independently obtaining the history in this example and performing osteopathic exam, as well as independently diagnosing and treating somatic dysfunction in a common condition. If it's a more complex case, then it's a 3.5. Medical knowledge, level 3, because they're integrating knowledge of OMT techniques to formulate a plan. They said, I'm going to only use indirect technique because of the whiplash injury. And then finally, they're providing level 3 systems-based. They're providing osteopathic patient care, and they're doing correct documentation, billing, coding of osteopathic somatic dysfunction. Next slide.
I'm going to take over again here. Thank you so much. I think, and I hope that that was really helpful for all of you to think about, again, how it is that we're able to use those various patient encounters to think about both sets of milestones. There are a lot of materials available on the ACGME website. Next slide. And I'm just going to help you find a few of them. First of all, we have milestone webcasts. These are, they're 10 to 15 minutes long. It talks about the changes to the milestones, especially the format, talks about content changes. And finally, the last part talks about how to use the supplemental guide. You know, one thing with the supplemental guide to remember is that it is available as a Word version, which means that you can go in and create your own examples for what these things look like in your program. Again, Abby said it, you know, we did our best to create examples for everybody. But of course, if we would have had an example for every specialty, for every subcompetency and every individual milestone, your supplemental guide would have been about 900 pages long instead of 45 pages long. So keep that in mind. Next slide. And then we also have all of these other resources available for you. We have guidebooks for all kinds of topics. Our assessment guidebook really walks you through how and when to use different types of assessment. The implementation guidebook is really good for any sort of change management, but it really is focused on how to implement good milestones. The Milestones guidebook talks about competency-based medical education, as well as the process used for developing the milestones. The Milestones guidebook for residents and fellows, I want to encourage you, especially, we're getting to the end of an academic year and you'll have new residents and fellows coming in over the summer. This Milestones guidebook for residents and fellows was written by residents and fellows, and it really talks about all the different things that they need to be aware of when it comes to milestones and even assessment, and really what their role is. Finally, the Clinical Competency Committee guidebook really can help you with all different aspects of your CCC. We're in the process of updating all of these guidebooks this year and hope to have them out by the fall. There has been a tremendous amount of research around CCCs done in the last couple of years, and we hope to synthesize all of that for you. And again, if you're not really wanting to read the whole guidebook, there are some great executive summaries. They're each only 1 to 2 pages and cover each of the primary areas that are in the guidebook itself. Next slide. There are, of course, also other FAQs, as well as, again, your supplemental guides. These are available on your osteopathic recognition page of the ACGME website. The one that's the template is the Word version. So again, that's the one you can use to go in and change the examples to be what you expect. Next slide. I mentioned the guidebook for residents and fellows. They actually even have their own page. So outside of where you can find the guidebook on the Milestones page, if you go to the residents and fellows page, you've got not only the guidebook, there is a PowerPoint presentation. Again, it was created by our residents and fellows, as well as a 1-page flyer that you can hang up that, again, really highlights those key areas that they need to be aware of. Next slide. We have quite a few other activities available on both virtually and in person. One of our most popular ones is developing faculty competencies and assessment. This is a 6-day assessment course, and these particular courses, I've never heard anybody say that they didn't come away with more information than what they had at the beginning. There are occasional opportunities to do this virtually as well. And so I would encourage you to also see the activities that are available on Learn. This includes some activities that you are able to get credit for, including if something that you need, there is a complete program for DEI, which is a really fantastic program. And again, these are all free. Everything that's online is free, that is. The course that we have, I just saw posted a comment about whether or not these are conferences. These are actually, it is an in-person conference that's held. There are also some 3-day versions that are held regionally. Our Michigan, there's a group in Michigan from the Michigan College of Osteopathic Medicine, and they do a 3-day course for this as well. Again, it is in person. Next slide. We do have 2 free assessment tools available to you that you would download them. They work with your resident management system. And what's great is that it becomes part of an app that your faculty can use. If you already have a good program of assessment, you might just want to look at these 2 assessment tools just to see if it can give you ideas for maybe some new enhancements that you can give to your already existing ones. Next slide. There is a Milestones report. I can tell you that although it has taken us some time to get to it, we are finally in the process of developing an osteopathic recognition milestone report. It's a little tricky simply because there are some specialties like family medicine that have a lot of programs that use osteopathic recognition. But then there are other specialties where there are very few. And so we've been struggling with trying to figure out how to give you a report that makes the most sense. The new format that we have, we think is going to be what's going to finally work because we're using the same scale for everybody. We expect to see that in the fall, but you can, however, see your family medicine milestone report in this annual report that comes out. Next slide. And if you have not seen this supplement from JGME, which, if you're not aware, is open access, and which means you can go ahead and go right to this particular supplement. It's 2 years old now, but it is still very relevant. It is all about milestones, clinical competency committees, assessment, and implementation. It's one of those that if you had the physical copy, you would have things highlighted and tabbed and pages folded over and sticky notes and all of those things. It really is a great resource for all things related to these topics. Next slide. And with that, we are ready to go to questions.
Well, I truly want to thank our speakers for bringing updates on new and improved osteopathic recognition milestones, personally for reducing the medical jargon and also seeking to create symmetry with the specialty and family medicine specific milestones. It helps when you see those lined up and that you're not forcing programs and residents to go over multiple different steps, but they align. So thank you for that. We've had a number of questions that have come in through the Q&A session. I'll read a few, but also if there's any in attendance that would like to ask a question directly, please raise your hand and Scott can unmute you. So I'll ask first, will you be speaking to how to assist DO residents if our family medicine residency program does not have DO faculty members actively practicing osteopathic techniques?
I can take this one. So I would say the best thing to do is try to contact the local osteopathic school in your state or nearby state, because usually they have set up workshops. I know that AT Still University does have a program that you can purchase, that they have all of their OMM workshops that they provide virtually, that they can stream the lectures. So that would be the first thing, or find a program nearby that has osteopathic recognition that they might be able to attend some of the lectures.
Scott had listed what we do, the webpage with milestones. We'll feature that again here at the end of the chat box. But there was questions about both the conferences and the resources. Are there any other websites that we missed or website that would have listings of those that we'd be willing to share?
So all of those resources are on various pages of the ACGME website. The two places essentially where you're going to start is you're going to go to what we do, and milestones as well as osteopathic recognition are both listed under that category. And then on the resources page, you'll not only find the resources I talked about, but also our newly formed clinician educator milestones. So for those of you who have found that identity as a clinician educator, there are things that you can use as well to help improve your own clinician educator skills.
In addition to that, Scott commented that we'll be posting this recording, a PDF of all the slides, and a list of those websites on the FMEC site after the session today for those of you that are interested as well. I had another question for our panelists, and if a new program were interested, say there's a program director who happened to be on the session today that just wants to get started, maybe they haven't really started to carve out, review the supplemental materials. Do you have any advice for a new program that's interested in moving towards or starting the journey towards osteopathic recognition?
So I'll just start with some basics. Tiffany Moss, who is the executive director for osteopathic recognition at ACGME, I would call her. She is fabulous, and she is going to be able to guide you, as you're thinking about the process. And then Abby, you might have more practical things to do, but but Tiffany is my go-to for all things osteopathic recognition.
Yeah, I would say the hardest part isn't necessarily the application, it's all the additional documents, because there's very specific wording in it, so you really have to delineate that. The two things I would recommend would be, the first being the ACGME annual conference does a AOGME, ACGME combined pre-conference about osteopathic recognition. That helped me phenomenally with my site visit, and you can actually even chat with the site visitors to ask specific questions to prep you. They also, as part of that pre-conference day during their normal ACGME conference, they also have a specific program that was new this year that was specific for those people who are new to osteopathic recognition or a new osteopathic director. The other one I recommend is the ACOFP Faculty Development and Program Directors Workshop, because that's another great thing that gives you all the updates. Tiffany Moss and Laura usually talk at that conference about specific things. So those are the two places I would start. And a lot of them are online now, recorded. I know that the ACGME pre-conference was not recorded, but ACOFP FDPDW was. I always have to think about the letters that I'm saying.
Alphabet soup.
Yeah. But it's Faculty Development Program Directors Workshop, and that was recorded this year. So that's available to watch those lectures with all the updates about osteopathic recognition and the exam. So those are some good start resources. There's also some webinars too from the ACGME.
We've certainly given us a lot to review. I appreciate particularly references that residents and fellows can utilize. And so I thank you for being attentive to give them opportunities to engage the material directly. I appreciate a lot of the material for prep for CCC, for the specific clerkship or residency specific rotation milestones that could be evaluated. The only question I'll ask just to finish would be, as you look ahead, and I know you had talked about trying to align some of the specialty specifics a little bit more meaningfully, milestones with osteopathic milestones. Are there any other things that you can see in the next 5 or 10 years that the ACGME others may be moving towards, or anything else on the horizon with regard to osteopathic recognition?
So I can answer that in more generalities. One of the things I notice a lot in my talks, we talk about before times and after times, of course, referring to the pandemic. The during times, one of the things that became really apparent was the necessity for competency-based assessment. And although there are no complete directives at this point, we are definitely on the move towards that. And so I would say that it's going to be really important for all of you to, as you're thinking about your program, as you're thinking about your curriculum and your manners of assessment, to really start thinking towards competency-based assessment. Because I really, within the next 10 years, I'm sure it's going to be required probably by every certification board. And so I think that is even true in osteopathic recognition, although obviously this itself doesn't lead to the certification. I think that you're actually in a really good place for this transition, because so much of what you do is already so well defined. Whereas in some specialties, it's not as well defined. And so I think that if you start putting that kind of on a back burner and bringing it up periodically with your faculty, start thinking about those assessments and how you're going to do it, and what those key competency activities are going to be. Abby, do you have anything to add to that?
I don't think so, but I mean, I think we were trying to also, get the language more familiar, with these milestones to be closer to the ACGME regular milestones, as well as kind of delineate better. And also we made it a little bit vague on purpose, so you can choose what does osteopathic principles mean for your program. So it's not as specific as like, did they do, palliative care to the dying patient? We took a lot of that out and made them into examples, so you can, go forward into making it very program specific in terms of that.
Yeah. And that sometimes leads to the question of, well, if that's the case, then, what's the point? We all have the same requirements. The example I like to give for this is emergency medicine. So I am in Chicago. Now, there are, I think, 8 emergency medicine residency programs in the city of Chicago. If you are at Northwestern Memorial Hospital, which many of you might know, it's a very large, top tier academic medical center, and Cook County Hospital, which is one of the largest county hospitals in the country, which has primarily a government funded patient base. Unfortunately, they are the site that sees most victims of violence. The experience that those learners get at those 2 sites are completely different. And yet they have the same program requirements. They are working towards the same certification boards. The same can be true of any specialty and of osteopathic recognition. 2 programs that are next to each other are going to look very different simply because your patient population is different. And so that's why it's so important to think about this in terms of your program specifically and how these milestones fit in to your patient population, your curriculum, your program of assessment.
Well said. Well, we certainly appreciate your time, your energy, your efforts to advance these milestones and others. And we thank you for the opportunity to engage us a little more deeply today. We look forward to seeing all of you in October in Providence, Rhode Island, October 13th through the 15th for our annual FMEC meeting. And we'll see you then. Have a wonderful day.
Thank you.